Okay, so I want to start the slides. There. Now I feel like I'm prepared. What I want to welcome you all to the family exchange for today and for this NTAC session. And so we're excited that you are here and you're here to listen to an important topic on research to results. Fredla does a lot of research, and we did some of our own. We gather the research, and then we did some of our own as well. And so we're happy to be sharing that with you today. So thank you for taking time out of your busy schedules to join us. Before we get started, we just have a few housekeeping items to go over. They're the same ones I go over every single time, but let's go quickly through them. If you have something that you need me to, or have any questions, please feel free to put it in our chat box, and then we can answer those as we go along. Also, we'd like you to put in the chat box, take a minute to tell us what organization you're from, what role you have, and where you're located, if you can do that for me, please. So this disclaimer is that this presentation was prepared by NTAC under a cooperative agreement from SAMHSA. And while this event is supported by SAMHSA, the contents are those of the authors and do not necessarily represent the official views of SAMHSA, HHS, or the US government. So while we hope there's not any security issues that happen today, in the event that any may occur, this session will be immediately ended, and you'll be notified by email how to rejoin a new session. We're grateful for all of the NTAC partners that we work together to utilize our expertise and subject matter knowledge to help inform the field by creating products, resources, and sessions like this one to enhance the behavioral and mental health fields. As a center, our vision is that all children and youth and families living with and impacted by mental health challenges will have access to the resources and opportunities they need to thrive in a comprehensive and equitable system of care. We serve a wide cross-sector audience, including everyone from state leaders to providers to school workforce, infant and early childhood providers, community-based providers, peer supervisors, family partners, youth partners, and much more. Our services range from individual consultation to a more in-depth sessions like the one we're offering today, to peer learning exchanges and tools to help you. Our aim is to really create those outlets for communication, collaboration, and resource sharing amongst all of us. So please feel free to visit the NTAC website at www.ntacmentalhealth.com. We'll give you that information in the chat and also at the end of our presentation. So look for the following information after today's session. So we get these questions often, that's why they address them. You will get a certificate, and it will be automatically emailed to you online in a follow-up email. And if you join the phone early, please email Bridget to report your participation. Oh, if you joined through the phone only, not early. Okay, I can read. Can I get a copy of the presentation that was used for this event? Again, we've reordered the slides from the one that you received. You will get a copy of this presentation in that follow-up email. And there will be a recording of this event that will be also in the follow-up email. And as I just learned today, it will also be in the NTAC's YouTube website in a couple of weeks or a couple of months, Bridget? I can't remember what you said.
A little of this, little of that, somewhere in
Okay,
between.
okay. It'll be available at some time in the future if you want to share it with people who in your organization or who you work with. So welcome to today's session, From Research to Results, and we're going to be talking about the benefits of engaging families. We have a little bit of an agenda. Just so you know, we're doing the welcome and introductions through the chat. And we're going to talk about how it all started, how change is complex, and let's focus on what we can do. And then there's some research on positive outcomes for engaging families that we'll discuss. And then we'll follow up at the end with next month's topic when we say goodbye, but not yet. Pat Hunt is the executive director of Fredla, and partner at the NTAC TA Center. And I am going to be doing her polls and doing facilitating this and facilitating the chat. So if there's anything coming from, if you have questions, please feel free to use that chat. Our objectives today are to understand the benefits of engaging with families in care, describe the value of family engagement toward positive outcomes, and explore methods for engaging, supporting, and retaining family experience and expertise in 3 key areas, and that's in care, in agencies, and in system design. So now I'm going to turn it over to you, Pat, and you can take over.
Thanks so much, Lori, and thank you all for joining us today. We really appreciate it. As you can tell from our conversation so far, Lori's the one who's going to do the hard work today, and I'm just along for the ride. So thank you for joining us. The family movement, I think, and the change and attention to the needs of children and youth with mental health conditions really were highlighted throughout Jane Nitz's publication of Unclaimed Children. And I have to say, it kind of saddens me a little bit today to know that we have not, as of today, moved that far down the line from where we were in 1982. I think we made great strides and changes up until about 2000, a little after 2000. And now we seem to be going backwards in the need and the call to action for families. And obviously your commitment to engaging families in this work is evident by the fact that you're here. So thank you for that. Next slide, please. Lori?
Yep, I'm trying. There it goes.
Thank you. So you guys all know why today's topic is important, or you wouldn't have joined us. But I think the engagement of families is often overlooked or addressed late in the process. So there are missed opportunities when we could have engaged families to either design or develop programs, to speak up on regarding the care of their own children and developing a plan of care. And we know that when families are engaged in their child's care in all aspects of it, the child has better outcomes. So we're going to show you lots of research, over 30 years worth of research later in this presentation that documents that. Next slide, please. So we know that families define their members. Families are unique. We call it a clan, a network, a tribe, call it a family. Whatever you call it, whoever you are, you need one. So we love this definition that Paul Yarango, who is a family advocate and co-founder of Family Voices from New Mexico, developed, and we use it in all of our work to really think about families. Families are sometimes blood related and very often not. And so families are whoever we choose to be our families, right? For lots of reasons. And the same for the young people in our lives. So thank you. Next slide. Involvement, engagement are not the one and the same. They're two very distinct concepts that look different in practice and they yield different outcomes and results. But partnership with families is different from both of the above. So although these words often get used interchangeably, they are not. So if we can go to the next slide, you'll see some examples of each of those. And really, involvement is about showing up. Very often people measure family involvement by how many families came to this, or how many families did this particular task, or rather than engagement, which is about stepping up, right? That's about actively participating. So we have showing up, stepping up, and then we kind of have stepping out in the partnership, where families have a role in developing all sorts of things, and designing programs, and developing job descriptions, and hiring practices and operations, serving on policy making and governance bodies, and really stepping out to be full partners in not only sharing power and decision making, but sharing responsibility. I think we often don't talk enough about what partnership really calls for. So we'll look at that a little more in depth today as well. So I'm going to give you just a few seconds to look at this slide. It sounds like you received it before today's meeting, but I think as you begin to think about this, the work in your communities or in your organization, to think about how you move along that continuum, and identify even small ways that you can advance toward partnership one at a time. We'll get you there. Thank you. We can do the next slide. So what strategies are you using to engage families from diverse cultures? You can put that in your chat box, if you will. Share your examples with us, and I'm going to rely on Lori to be my eyes because I can't see the chat along with the screen.
Kyle said a phrase around here is often used around here is authentic engagement.
Authentic, yes. Authentic engagement. That's right. With real lived, that means you have real lived experience in raising and supporting, and responsibility for raising children. So what strategies are you using to engage families from diverse cultures? How about those communities that either don't get enough services, they're not engaging in services, or they're overrepresented in other systems like child welfare and juvenile justice?
Ika says, when I'm not clear or sure, I simply ask questions.
Good.
Debbie says, look at the families you serve and draw members from the community.
Great strategies.
An open, curious mind. Oh, I lost it. Open, curious mindset when meeting families and getting to know them.
I just saw one flash up that says print literature in other languages, and have people who are familiar with that culture reach out to them. So.
Yeah. Employing translators is another one that goes right along with that.
So it doesn't mean that you have to do all the work. It means that you have to reach out and meet people from the community who can help you with engaging.
Partnering with organizations and community partners.
Great examples.
Do not be the expert. Let families know that they are also an expert.
Flexibility in times of day. Right.
Be respectful. I saw that. Use empathy.
Someone is from a diverse island. Did you see that one?
Yeah. Coming from a diverse island. Good for you.
Wonderful. So I think it's important for us to think about, sometimes we feel like we didn't do such a great job engaging families, but we may not think about the impact of grief on engagement. So Ken Moses work with grief and states of grief really makes us think about how does grief impact our engagement? We're reaching out to families sometimes who are in anger, who have a lot of anxiety or depression or stress going on about other things, guilt, fear, denial, all sorts of things are going on for families. And I know if you reach out and ask me something, even if you're a really lovely person and it's a positive thing that you want, if I'm going through all of that, I may not be as responsive as you'd like me to be. And so I think always to sort of tender your judgments of yourself and your ability to engage families with knowledge that not all families are at the same point in time when you're reaching out, and always keep the door open. Don't worry about going back, right? Go back again and keep the door open. I think that's really important too. Next slide. The added value of family partnership really is about its measurable value. It can change, build, improve, inform, and transform the systems in all of the areas noted there. So you think about together, all of these things drive a quality improvement cycle that brings about systemic and sustainable culture change. So if we change institutional culture and practice, self-efficacy is built, right? We improve individual outcomes and organizational outcomes. New practices. So really the value of family partnership is about changing, building, improving, and informing. Next slide. So change is complex. A lot of things are about transactional, right? Did you have an appointment? Did you show up for the appointment? Did you go to school? Right? Did you get a good grade? All of those things are transactional. And in order to apply the change that's needed, you have to be transformational. And that's about developing relationships. It's no more about how many widgets did you get, or what could you sell, right? Or what did someone buy? It's about relational, because once you have the relational piece in place and you have moved through that transformational piece to where you can be relational, you can achieve a lot more positive outcomes, and you can get a lot more family engagement. Families don't want to just show up to do something. They want to know it's going to make a difference. Right? Someone says family partnerships also allow those that may not feel competent to see others. Yeah. Great. You guys have got some great stuff in the chat box that I can't even keep up with. But so I think really when we talk about change, we have to think about how do we move from transactional to relational? And that's what really engages families. Next slide, please. As we know, that whole transformational piece is easier said than done, right? When we know success happens outside of our comfort zone, and John Lyons talks about our work as being transformational, involving families and youth is transformational for systems. So we move from that prescriptive to partnership. And children, youth, and families are not one-dimensional. There's far more to them and their lives than we see on the pathway from which they arrive. Right? They may come through the door of child welfare. They may come through the door of juvenile justice. They may come through the door of the crisis center. but there is far more to their journey and to their lives than what we see at that moment. So stepping out of our comfort zone to do those kinds of things you've been talking about in the chat box, to be open, to ask questions, to listen. And you'll know more, and the relationship will be stronger, and they will be more engaged in whatever aspect of treatment or program that they are. Next slide.
Debbie says it's important to get buy-in from providers and organizations. Oftentimes, the experts feel that we have nothing to offer.
So I'm going to tell you what you have to offer. You're going to have slides. You already have slides, but they're going to be reordered for you. And what you have to offer are the outcomes we're going to talk about later, because I don't know any state or local organization that would not want to buy those outcomes. And those outcomes come from engaging families. So we're going to talk about that in a few minutes, and you'll get to see some of the things that I think you can use to actually, for lack of a better way, market and sell the value of family engagement, because there is great return on investment by engaging families.
And
Next
Tika
slide.
reminds us that we are the experts.
Thank you, Tika. So we need to prepare. The cultural differences and examples include urgency, right? Priorities, understanding of processes. So we have to set the table around people, language, rules, and addressing biases. Next slide. So we have a poll.
So in this poll, which area will be the biggest challenge for you in your agency to advance family engagement? Yep, we'll just give you, and if we don't have the answer here for you, please add it in the chat box.
If you really want to maximize family engagement, what's your biggest challenge?
And resource realignment seems to be ahead.
I don't see that, so
Oh, you don't see the poll?
I don't see the results of the poll.
Oh. Resource realignment. The next one is agency readiness. And the
Yeah,
next one is culture change.
thank you. Is everybody done
But
voting on that?
It's still moving, so let's just give it a second
Good.
more. Okay, looks like it's done. I'll end it.
Okay, and did they keep the same order? Resource realignment. Oh, there we go. Is there anyone who would be willing to give us an example of resource realignment that you think needs to happen in order to advance family engagement?
So we do have somebody with us from Guam,
Okay.
Demisha, I think that's how you say it. There are a lot of resources aren't available on Guam for many families, or they just aren't aware of them.
Yeah. Thank you. We can go to the next slide. Thank you, Lori. So let's focus on what we've learned. You can continue to change the slide. So you will have a handout after today's meeting, strategies for engaging families in 3 arenas. If we kept that in our presentation, we would go over time probably. I'm looking forward to hearing from you rather than you hearing from me as well. So engaging families in care, in agencies, and in policy and funding decisions. And Lori, thank you for putting that handout in the chat box for folks.
You're welcome.
You can download it from the chat box. Next slide. So it's really important about connecting culture, not just your culture, if you're working with families, but the family's culture and the agency culture. And we know there are huge cultural differences among people, as there are among organizations. And so some people are really not comfortable speaking up or stepping out. We know that's part of their culture. And so I think it's important. Thank you, Bonnie. I think it's important to consider that when you're working with diverse cultures. And really that maybe culture is not about, not only about our ethnicity or our race, it's about what's been the norm in the family, right? So family norms are their culture, how they celebrate, who speaks and who doesn't speak, who speaks for the family and who doesn't speak for the family. So really connecting all of those pieces of culture is a challenge when you're trying to engage families, because you may have a great, you may really value family voice, and the families may value family voice, and your agency, either at the top or the bottom or the middle, may not quite be there yet. And so helping shift that culture inside your organization is going to be important too. Yes, community culture, absolutely.
Yeah.
And then we have the culture of state agencies, talk about that for like an hour, right? So thank you. We can look at the next slide now. I know I'm going through these a little fast, but I want to make sure that we can hear from you when we're done. So we're going to share a little research on positive outcomes from engaging families. We can move on, Lori. So engaging families is everyone's business. In 2022, we took a really good review of research around engaging families in all various aspects of care. And what were those positive outcomes for children and youth? Because engaging families does have an outcome for their children, whether it's their child who's receiving services or their siblings, has an impact on their whole family, has positive outcomes for agencies and facilities that are serving children, for managed care organizations, for the community, and for the system as a whole. And I urge you to use these slides however you can to begin to talk about the strengths of engaging families and the positive outcomes, so that you can get those people who are not solidly there yet in that belief that there's a return on investment. You maybe can get their attention, and they'll be more willing to focus on engaging families. Next slide. So it's more than us who say that engaging families is important. There are more than 65 researchers. That was only as a couple of years ago. Lots of people have contacted me with more research. If I have time ever again to go through more of that, I'm sure we'll find lots more research and positive outcomes on engaging families. But this really, this presentation reflects over 30 years worth of research about these positive outcomes. We did not like some of these people more than others, so we made their names really big. Their names are really big because they've been cited in certain numbers of research. So the ones whose names are in bigger and bolder font have done more research on this topic. So that's why it looks like it does. Next slide.
Blanca says, a lot of times I don't believe some agencies understand the work family peers do to break those barriers.
Okay. We're going to talk about that. So let's move on to the, so we've broken these up into several slides. We put it together on one slide to just show the power of it all, but for you to be able to read it today, thanks to folks at NTAC and at CARS, they broke it up into a variety of slides. So I want you to notice the difference that family engagement makes. Research says for children and youth. Adjustment, functioning, quality of life, improved skills, decreased isolation, decreased risk of mortality. Preventing relapse, recidivism, and deeper engagement with child welfare and juvenile justice. I ask you to give serious consideration to the different types of bullets. The bullets at the bottom: improved achievement in school, better overall social emotional well-being, less likelihood for teen pregnancy, reduced infant mortality, and less likely for incarceration as juveniles, all come from engaging dads. All come from engaging dads. So that's pretty powerful sell, right? If you think about it, there is research that says engaging families leads to all of these outcomes for children and youth. Next slide. And the outcomes for families are around stable living situation, decreased parenting stress, improve parent confidence in their ability to parent, to handle stressful circumstances, facilitate access to insurance. Many times families come to family organizations or they reach out to other families because they don't know how to get something paid for that they need. So family dynamics are stronger and more positive because skills are being developed. Reduced parenting stress for partners. Teen males who live with fathers are less likely to carry guns and deal drugs. And reduce sibling discord. Those last three are from engaging dads. Has anybody thumbs up or not, or raise your hand or not, so far seen a positive outcome that surprises you? Any one of these? Thank you. Next
The
slide.
one that, I'm sorry.
Yeah.
The one that was probably the most interesting to me was teen males who live with fathers are less likely to carry guns and deal drugs.
Isn't that phenomenal?
It
What a
is.
wonderful
It
outcome.
truly is. Yes, because we sometimes don't understand like the ripple effect, right? That a little bit of engagement has in the whole family and family dynamics. So
Thank
it's
you, Barbara.
amazing. Thank you. Thank you.
Thank you. Next slide. Yes, they are, Debbie. Extremely important. So here's where you really can use with agencies and managed care companies some good information. Thank you, Sherry. Earlier access to service, improved quality of care, improved clinical outcomes. No agency is going to not want these kind of outcomes. Increased satisfaction of staff in their careers. Let me talk about that a minute. We are in a workforce crisis, and we're always talking about workforce development, workforce development, workforce development. How about workforce retention, right? If people are more satisfied in their careers, they are most likely to stay in those careers. Improved data collection, client satisfaction with care, and more successful involvement in care. This all comes from family engagement. Remember, over 30 years worth of research So talk to the agencies, talk to the facilities, talk to the providers, and let them know there's return on their investment. Right? Nobody wants poor outcomes. So they have an opportunity to engage families in new ways to help them really get to these positive outcomes. For managed care, improve coordination of care, strengthen engagement and treatment. Really, they can do a better job of stewarding resources, providing additional resources for reinvestment in new types of services or in supporting families to be engaged in those services. And big one here, yields better clinical outcomes. Right? Engaging families yields better clinical outcomes.
Sorry.
Debbie, I can see part of what you put in the chat. Are you willing to say it out loud so I can hear it?
Yes, ma'am. I think those of us with lived experience, especially with children with special health care needs, I know myself, I derive satisfaction by helping others in similar situations because I did not get that help when my children were smaller. And it makes me feel good when I can point people in the right direction and assure them that their voice is important, and also ensure them that what they say matters because they know their children best. And I think any provider or insurance company would be, excuse me, be fools not to listen to us, because we are the consumer. We are what gives them a job. And I just really think that those of us that have gone through the situations that we live through and have not had that help, it just gives me great pleasure to help other people that need it when I needed it and didn't get it.
Thank you, Debbie. Nice point made. Thank you. Anything on this slide surprise anyone? No? We'll go to the next slide then. So in the community, it's really about making sure that young people can stay in their communities, at home and in their communities. That it's about young people growing up and their families exercising their voice and their participation and growing up and voting, and communities are stronger, right? And it reduces the disconnection from their culture. So very sad. Once I worked in, well, several times I worked in Alaska, and they were talking about their young people who were being sent out of state. Think about that statement, out of state. And so their children were going to Arizona and Texas. And I can't imagine waking up in the morning and looking out the window and not even seeing landscape that looks familiar. So really keeping people connected to their communities and increasing the community's awareness of children's mental health issues.
I know
And-
as a family org executive director for many years, I got a phone call from Alaska, an Alaskan newspaper, asking me what we were doing to help those 2,000 kids that were in the state of Utah. So I didn't even know, because they're all in private and we were only working public at the time. So yeah, that was very difficult.
So when you give that example, Laurie, that's a lot of money. So when you talk about resource realignment, that's another cell. And for the system itself, we have more effective and efficient use of state and federal resources among systems, reduced out-of-home placements. We are in a, we talk about pandemics. This is the pandemic right now. The overloading of residential options, only because we don't have the resources for community-based care. we have resources, but 86% of all mental health resources go to some form of residential care, whether it's hospital or traditional residential. So we would reduce over-reliance on services and improve data for good decision-making for systems. And why we've color-coded this little graphic the way that it is, you can see one color sort of bleeds into the next, because what happens with children and youth happens to their families. It impacts their families. It impacts agencies and facilities and managed care companies and communities and systems. We then want the systems to take that information back to make things positive, improve services for children and youth. So that circle goes on and on, right? It's continuous. Next slide. So we're going to translate the outcomes to at least 50 family functions. We've identified family functions for the roles of families and their family-run organizations. This is not every family, but it's roles for families. And so as you engage families, be thinking about these roles. Next slide. So we have families, and as you think about parent-peer support, right? Participating on planning teams. How are we supporting this linkage to housing, employment, and other necessities? Really think about job descriptions that you have for families in your organizations, agencies, whether it's provider agencies or community organizations or the state system itself. Think about the functions that families can fill around all of these areas. So we help families navigate through systems, prepare and support for policy work, leadership training, mentoring other families. I think that's an example. You know, Debbie was talking about being so glad to give back now and do for families what wasn't done for her. And thinking about the development of life skills for children and youth. You know, we don't pay enough attention to linking youth and families to the skill and resiliency building activities. And if we don't do that, we're setting them up. So having families play roles in all of these things with children, youth, and their families is very important. So other roles and functions. Next slide. So for agencies and facilities, I've seen examples be very powerful when we have families as partners in care coordination. So you have a family and a care coordinator who work as a dyad in intensive care coordination, even in intensive care coordination, to really make sure that families are getting what they want and need. Gathering client satisfaction, hosting focus groups, surveys, pre, during, and post out-of-home placement. I would use the same around hospitalization, performing ambulatory follow-up functions. That's managed care language, so I'm going to, and agency language, so I'm going to talk about that for a minute. If you have a family who's supporting a family who has a child in the hospital, and you know, I'm sorry, it's always magic. The child's always ready for discharge on Friday afternoon, right? Late Friday afternoon. And so hospitals sometimes take away all the medication and start new medications. And then the child leaves on Friday afternoon. But the parents are thinking about all these other things because they're excited their child's coming home, but they're nervous and they're worried. And is this going to work? And how is this going to work? And then they go to the pharmacy to get the new prescription. Now they've already left the hospital. And the pharmacist says, This requires prior authorization. Right? You're gonna have to wait 3 or 4 days because we can't fill this and they're not gonna give us that authorization till next week. So now the child has no medication. What do you think the chances for a successful release from the hospital are at that moment? They're going down, 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 right? But if you have parents who are providing parent support to someone who's in the hospital, who has a child in the hospital, they would think to ask these questions, right? And they would say, are you going to send this child home with medication? If not, what are you going to do about this? Because that's not the solution. So you see the value and the value add, because the chances are within 5 days that child could be back at the hospital or in crisis services, or the police could be knocking on the door. I mean, there's a whole bunch of really scary scenarios happen when families don't get what they need. So the value of families in these roles is really crucial. And providing workforce training and serving on governance bodies and ad hoc groups of those agencies is really a powerful opportunity. Next slide, please.
And Debbie reminds us that maybe you get authorization, but you can't afford the copay.
Absolutely. Absolutely. Yep. So managed care, informing that medical necessity criteria. Until I worked for a managed care organization for over 10 years, until I went there, I didn't realize the secret sauce. The secret sauce is who's in and who's out, who gets what, right? And that's called medical necessity criteria. Somebody writes the criteria for when you get a particular service. What are the X number of things that have to be in place, right? And so it's really important for families to work with managed care organizations or states, depending on if there's a managed care contract or not, to inform that medical necessity criteria. Because only when it's broad enough to meet the real need of families is it going to have better outcomes. Okay. To do outreach and enrollment, be part of a care coordination team doing that follow-up. Coordinating discharge planning and influence the continuity of care. How many times are we discharged and there's a plan? Our children have a plan for services that do not exist, or they're complex to get into, or there's a long waiting list. And coaching the workforce. Next slide will take us to the community and system. So linking others to community resources, families have a big role in that. Coordinating community and cultural discovery events. It is such a fabulous opportunity when families work with the multiple cultures in their communities and around their communities to come together and have an event of cultural discovery with one another by sharing food and music and art. So, we talk about how are you advancing acceptance? How are you advancing real cultural work is about doing these kinds of activities that people don't put enough money into. And families and family organizations could have a real role in that. The welcome back to the community for children who have been placed outside of the community, who feel like an outsider when they come back because they just missed their family, their friends, their teachers, their coaches, the ice cream shop down the street, their favorite pizza, right? They've missed all of that, sometimes for over a year. How do we welcome them back? It's really important. To have a sense of belonging is one of the most important things we can do for a child. So what role can families play in that? For systems, informing decision makers about service needs and experience with access to care, providing that authentic family voice on policy committees. Here's a golden opportunity, number 3, really informing that procurement effort. And that's when the state is planning to release an opportunity for a managed care company. You should be informing what that looks like and informing the insurance industry about the kinds of things that you want covered for care. So I think the more as that families participate and are engaged with family-run organizations, the more they can have this kind of opportunity and make this kind of opportunity. We don't have the luxury of waiting for someone to offer it to us, but working together to make sure that it does happen, because that's how change happens. And families as consultants. So we've now shared over 50 roles with you, 50 possible roles that can go into job descriptions for families. Next slide. So I'm
Okay.
wondering
Yeah.
how,
Go ahead.
yeah, go ahead.
This is our second poll, just to gather some more information from you all. How will you apply something that you learned today? That's what we're kind of asking. We have some thoughts here. If you don't find what you're looking for on this list, please put something in the chat so that we can talk about it. So we're coming up with engaging families in a different way, or using research are kind of neck and neck here. Identify where my agency can incorporate new roles for families. Has taken the lead. Engage families in a different way is right up there still. I'm really happy to hear some people using research, because that is what helps validate the work of families.
Excuse me, Miss Lori, can I say something?
Of course you may.
Thank you. I put in the chat that I think it's important that family members, leaders, peers, people that are trying to encourage engagement are actually paid for their time, because a lot of times people don't think about us as being important enough to be a member of the group that make the decisions, and they don't think we need to be paid, but our expertise is important and our time is valuable just as any other experts is. And I think that if nothing else, they could consider us as a professional collaborator or a consultant, professional consultants, if they don't like that word family leader or family navigator. But we are consultants, and they do need to pay the consultants for their time.
You're absolutely right. Absolutely. And I hope that's implied when I talk about, family engagement is there are a lot of things we could talk about today. It's around the preparation. It's around the kinds of things that support authentic family engagement, the resources that it calls for. And I like Shannon's comment. Yes, and equitable pay. Absolutely right. Thank you. All right, we can take that poll down. Thank you. Next slide.
Somebody said, Tika said, I've always believed that our lived experience is research, and the outcomes from the data should change systems throughout.
I also would like to say something, if I may.
Of course.
So here in California, we are already paid. We need to be certified, but it seems like they're just making it more difficult for those people who are courageous enough or knowledgeable enough to be able to help other people. And my fear is that we making it such difficult for them to apply that we are ending up on the same place where for the states that actually don't have this this jobs, available, if that makes sense.
It does make sense, and I think you're right. And I think a lot of people think in terms of barriers. They think in terms of, oh, who should we exclude, not how can we include people, right? And how can we make it as easy as possible? That comes sometimes from systems in particular. We see sometimes things get really complicated from systems, and I think lived experience comes with its own value and should be supported. Not we need to keep people safe. We need to keep people employed and doing a good job, but we need to support people the way they should be supported and show a respect for them by doing that, and that we value their contributions, because what I know is not what Laurie knows, is not what Debbie knows. You all bring such valuable wealth to this work. It is important to make it as easy for people to engage as possible. So thank you for that comment. We have, you can just quickly go through the citations. People will have them in their slides, but.
Yeah, I just wanted to say that Linda said perhaps our next round of this discussion can focus on engagement compensation. And that is something that Fredla has undertaken, is to do, we did a survey. When did we do that? The end of last year, the beginning of this year, to talk about or to find out about engagement compensation around the country. So we'll be happy to share that information soon.
And we also share your observation that it's not enough.
Yeah, it's not enough. Yes.
It's not enough. I think that's an advocacy agenda for all of us collectively across the country. You can flip through these because everybody has a copy of these. We just wanted to make sure that we included all the citations to the research so that you can link those outcomes to citations, because somebody might actually ask you, who researched that? Who said that? Where did you find that? Right? So we want to make sure that you have all the tools that you need at your disposal.
And the next two slides are additional resources on family engagement and family partnerships and working with fathers. I think we have a resource in here about working with fathers, and
right.
Yeah. Anyway, so we have a lot of resources there for you. So we want to open it up and just see if I'll stop sharing for a minute.
Good. I can see people.
Yeah. And see if any of you have any questions or comments about this presentation or anything that you would like to bring up. Any thoughts?
It's your
Thank you so
turn.
much for opening this spaces for us. It's hard to find, I guess, safe spaces for us to really, the ones that are like myself, I'm already working, as a peer, and sometimes, we all know that this type of jobs are pretty lonely, and sometimes we don't find that community, Yeah, so thank you.
Oh, you're welcome. So glad that you came and joined us. So I'm just seeing lots of thank yous, and we really have about 20 more minutes. I'm happy to turn that 20 minutes back over to you, unless you have something else you would like to discuss.
I would like to tell Blanca not to discount herself for the work that she does, because all of us at some time or another get what they call imposter syndrome. We feel like we really shouldn't be here because maybe we don't quite know what we're doing, but that's not true. Everybody has something to offer, and everything is important, and everything that we do helps someone. If it's just one person and we've helped them, then we have accomplished great things.
Very well said. Thank you, Debbie.
I realize we've shared like a whole lot of information with you today, and you may be feeling like, oh my gosh, what was on that slide? And I'd really like to know more about that. So feel free to reach back out to us too if you have questions. I'd love to hear any comments. Are there things you're struggling with that you'd like, around family engagement, or that you'd like to bring up that maybe the group might have some insight on and be helpful to you?
I guess if I have any questions, I will probably say that I would like to know who's making the decisions about how the finding is, like spread, like who can I talk to so we can share some of the concerns around our positions in our field. Sometimes I believe that we don't hear about concerns because people don't know where to share them. It's not a matter that there's no concerns. It's more about I don't know who is the right person to talk about it. You know what I mean?
Right. So do you have a family organization? I don't know where you are, so I'm sorry.
I'm in yeah, it's okay. I'm in California. I'm in Sacramento, California.
So there's lots of contacts in California that we can share with you. I think California is very much county
Yes.
based system, and
Yeah.
so going to your county officials would be important. The state is also doing some fabulous work in California. Feel free to reach out to for example, the folks in mental health at the state level. I think having conversations with providers and provider groups, if you know who they are, and talking about, here's what I learned around the value. And I'm wondering, have you thought about different new ways to engage families in your work? Just sometimes it's just about a conversation. Remember, we talked about relational. So
Yeah.
maybe not going and demanding, but developing a relationship and
I
saying,
absolutely.
here's how I can help you think about that.
Yes, of course. Thank you.
Yeah, you're welcome.
Hi, Lori. This is Beverly.
Hi.
Hi, I have a question. One of my biggest challenges is once I get the family engaged as a peer support and started giving them the resources and things start getting better, or I don't know, I guess things start getting better, keeping them engaged. Is that something that everybody struggles with? Like, I would like to try to be more preventive, you know what I mean, than for them to be in a crisis and then come to me. I do connect with them by phone, text, and things like that, but it's hard for them to stay connected with me. And I don't know. I just need a little bit of help to see what is it anything that I'm doing wrong? How can I help, help them get more engaged by providing them with, staying engaged with me and being more out in the community, participating in support groups. And I know sometimes people don't do that, but it seems like once everything starts getting better, us with that lived experience, we know that once that crisis starts, it's, it's like, it's all in our face and we can't, figure out how to do it without the support that we've already had, without, calling them and saying, hey, I need this help. I want them to know you don't have to reinvent the wheel. We just need you to start doing the things that were working and don't
Right.
stop doing the things that were working. So how do you all keep them engaged and help them be more preventive?
So Beverly, can I ask a clarifying question? Are
Yes,
you
ma'am.
talking about keeping the parents who provide peer support engaged? Or are you talking about keeping the families they serve engaged?
Keeping the families they serve engaged.
Okay. I think that comes with offering them a variety of opportunities, whether they're new learning opportunities such as come to a training, come to coffee talk, come, you know, other ways of supporting them. Maybe where they don't have to always leave home to do it. Sometimes we leave home for so many appointments and the school calls 14 times a week or, so sometimes offering. I love your idea about out in the community. I think how you can work with, if you don't have resources, work with other organizations who have can help you with additional resources and sponsor something in the community. And you know what? We all like to have fun. We all like to have positive things happen. So think about how you can build in some opportunities that can also be fun. It keeps people energized. Even, peer support workers. Can you imagine, the burnout days they must have, right? Because it's a lot of hard work. And so how do we keep the families engaged? And I know Jane Addams in Kansas had a program where there were 10 stages of that growth of engagement for families. And so there is some good information out there about that. Fredla will do some work to pull something together that can also be shared with this group.
And
Thank you.
we can't assume that they will always want to be involved with us.
No.
But if there is some way we can bring them along and help them learn how to give back to others, that's one way of keeping them involved in the work. And also, I know when we did wraparound here in Utah, it was the idea that the families would learn to be their own coordinators so that they were in charge of their own stuff. And so they had to stay involved in order to continue with the services in wraparound. And that goes along with what Pat said, that additional training, leadership training. Not everybody's going to want to give back to this work, but you'll find some real nuggets of gems of nuggets out there who are wanting to give back, and we'll find we talked to somebody who presented with us a couple of months ago, said this is my calling now and I understand this is what I want to do. So she had to come to that realization, and so that was that was a good thing. So
And Beverly, I
Absolutely.
would say the best way you can find out how to engage that, how to keep them engaged, is simply ask them.
Okay.
What is it you would like to do? How is it, what things are important to you? Just a real conversation. And you might come up with some great ideas. It's not all on your shoulders, Beverly. You're
Right.
doing a
We
great
try to
job.
carry so much.
I
We
know.
we
we
do.
I
don't want to
know.
fix it. We want to just, hey, this is what worked for me. Maybe this can work for you by keeping them engaged, and especially in the support network groups.
Yeah.
I see the connection between the families with each other, and then like the peer support, they just drop off like the conversation, and they pick up, and that's our hope here in South Carolina, Miss Pat, is to make sure that we have those other lived experience peers following behind us in their own community to build that support around them, not only just for the adult, for the youth as well, because once the parent has that stability under their belt, that youth is going to have that stability.
So I think skills is one piece of what we offer families. The other piece we have to offer them more often is opportunities.
Right.
Because if you have a skill and you don't get to use it, or you don't feel that it was valued, you know, then you're probably not going to participate too. So really, I think you're right, Debbie, and it's really building that next generation, or continuing to strengthen the generation we have of advocates.
Absolutely.
And it's great as a trainer to go in to a training like that and see the light bulbs go off. You know, oh yeah, this is the best thing I've ever heard, you know, so I love, that was very validating to me as well.
Anyone
Absolutely.
else? Thoughts you want to share? Struggles you have? How about a big success you've had in engaging families? Who wants to share one of those? All
I
right,
have one.
Danielle.
So we service children, and they were referred through the justice involved referral. And what I found in the beginning, this was last year, when I found in the beginning, the parents were always pointing the finger at the kid, like they're the problem, they're the one that's fixing, just medicate them, put them away. Like all that stuff was coming from the mom and the dad. And it took some time to obviously have the space for them to vent and to share and to go into different stories that they had experienced with their child. And then being able to just kind of say, hey, would you be open to discussing like family, how the family could come together to support your child, togetherness, bringing everyone onto the same page, because we're not in the mode of it's the kid's fault, you know, pointing the finger and not whatnot. We're the nucleus, like the whole person, the whole family. And it took some time, but I noticed that once mom got on board, that if she were to be open to sit in on some of the sessions and discuss some of the things that were happening and how it affected her, and then the doctor would give them different ideas to work at home, and they would call me to say, hey, this is working, or oh my god, we wouldn't have been able to have our heart open and our mind open to these new approaches, instead of seeing the child behavior as problems and her the problem. We're able to see that all of us make certain changes and all of us can adapt. We can be a better family, a better unit. And a year later, mom and dad are both in therapy. They understand now that medication is a help, it's not a hurt, and they are more willing to share with their therapist and with peer support, which that's what I am, to say, you know, all the pros and the cons, and versus what used to be negative. Now we're getting more like, wow, if it wasn't for the details and for the, you know, the open space, and those of us that have lived through the different things are able to say, hey, that's okay that you're going through it. We're going to get past it. It just takes the steps, right? Just trust the process, and you'll see the gains. And once they saw the fruit of their labor a year later, it was just amazing. Now they go speaking in different meetings that we have in different family groups and stuff, and they tell their story, and it's just so beautiful. They're so passionate about the whole process of having their hearts and their minds changing a little bit for the better of everybody involved. It made it for a better home environment for the child, and of course the positive behaviors came about, which didn't happen overnight, but it did happen. And it's just so beautiful to me, because when you can get mom and dad or caretaker or whoever involved, that we're not here to put down the child or to find more wrong. We're here to help them through the situation, hopefully better them or better with them, right? And when we hear the feedback, it's just so beautiful to see another success story that yes, it is possible, recovery is possible, and everybody gives that just a little bit of their heart and wanting to change and wanting to see the fruit of their labor. It's just so beautiful to me. And I just think, you know, everybody involved in their treatment team, and also for the child, because she came a long way too. And of course, no longer justice involved and in school and, you know, thriving. And that's what we want to see. And it's just so beautiful to me to see that success.
So Danielle, that's a fabulous story, a fabulous example. Thank you. And I guess it probably made you even more committed to your job when you see those kinds of outcomes, right?
Oh, by far, yes.
Yeah.
Yes, ma'am. But I'm not afraid to work it when we're in the thick of everything.
Exactly.
Yes, ma'am. So
thank you. Anyone else?
Thank you for sharing, Danielle. Thank you
Yeah.
for sharing. That is really inspiring. when I talk about in my position, I had a lot of instances where we can see, you know, the good work of the families and the resilience of them, and it brings to mind that a lot of the times it's not a single issue, right? It's housing, it's connection, it's education, is a feeling, that feeling of belonging. And once we start addressing one, it kind of has like a ripple effect, and it starts getting better. A lot of the families that I support specifically the parents of those children. So a lot of the times I see that the mom is struggling also with some kind of mental health, you know, need, or the father sometimes it's also dealing with substance abuse. So once we start addressing also those issues, so the child doesn't come back to the same environment, we can see that he starts doing a lot better. It's not only the medication that is not working, or it's not only one issue. Like usually it's never just one issue. So it's really inspiring to see once we start addressing, you know, the issues that the family has outside the services, the whole family starts growing. And once they see that it starts working, they become more committed to them. So yeah, so a lot of good stories to share. Thank you.
I realized, so mea culpa, I was remiss. I just want to take a second and acknowledge that another member of our Fredla family and NTAC team is here this afternoon. Shannon Crossbeer, you want to give a wave out or a shout out to everybody?
Just, just hello to everybody, and it's just such an honor to listen and to hear how many people are doing the work and considering doing the work. And, you know, we just want to give everybody the tools they need, right? In order to really elevate, not just elevate our voices, but to make sure that our voices are being responded to. So thanks.
Thank you,
Thanks for having
Shannon.
me here.
Yeah, thank you, Shannon. Okay, well, I'm going to share the last few slides that we have, and I wanted to let you know that next month we're going to have a training on trauma-informed care, and hope you will be able to join us for that one. And then if you are here, you're already registered, but please feel free to share this link with anybody who you would like to participate in that training coming up. So thank you for that. Again, you're going to get a certificate. You'll get a copy of the slides in the next couple of days, and the recording for this will be also in that follow-up email, but it will also be in NTAC's YouTube page sometime in the future if you wanted to come back and visit it again. So we need to keep hearing from you. You're going to get a copy of a survey. It's important. We have to respond to the national funders, SAMHSA, with specific questions that they ask us to follow up with the people who are involved in these webinars and trainings. So please take a few minutes. It really does help us as well know what we need to improve in our presentation so that we meet the needs of everybody who joins us. These are the NTAC sites that you want to enjoy or involved or connect to find more information about NTAC. NTAC stands for the National Training Technical Assistance Center. I use that, and I forget that some people don't know all of the verbiage. But here is their connection site, and SAMHSA's mission is to reduce the impact of substance abuse and mental illness on America's communities. And that is the last slide that we have. And I just want to leave you with that and thank you all again for participating. And I will hopefully see you all again next month. Thank you, Pat. Thank you. Thank you.
Thank you all.